IBM planning to eliminate $20 co-payments at the doctor's office for employees.
The company says it's part of a wellness program aimed at keeping costs low by preventing illnesses. But will it work?
Joining us now, author of Get Off the Dime, Dr. Sreedhar Potarazu. Doctor, IBM has had to be creative because it has such a huge employee number there. And do you think that this is the right thing to do, and will it make a difference?
They won't know if it's going to make a difference just yet. Lowering the $20 copayment may get folks in to see their primary care doctor, but what IBM really needs to know is that those folks are going to be healthy and back at work. And the challenge that employers have always had, although it sounds like a good idea, is knowing the full impact of whether they change a certain measure and if in fact gets the desired result. Simply changing the copayment won't give them an answer in terms of if everybody's going to actually get healthy and back at work and how they're going to measure that. Yeah. I've worked with IBM, for years, and many employers today are still beholden to the insurance companies to give them information about how these programs are performing, and the employers are in the dark.
Well, quantity is easy to measure, dollars and cents. Quality is very difficult, the quality of work that you do. And if you're not healthy, you won't do good work.
And when you talk about quantity and quality, I keep this in my pocket. For every dollar that IBM spends, when they just look at the cost, this is half of what they're spending just
Doctor, you didn't rip that in half.
I didn't. It got to me.
Gee whiz, don't show that. Oh, my gosh.
But the idea is that for every dollar they spend, the medical and the pharmacy is only half. If that person is not at work and being productive, that's almost 60 cents on every dollar that goes unmeasured.
If you want to look at the other side, you look at General Motors. Back during the bigger years, just a couple of years ago, their biggest expenditure was healthcare, and they found that there were more obese workers at General Motors than most corporations. Then you go to Cisco, where they put a doctor on staff to come up with wellness programs. They got to cut obesity. They knew it, and they're trying to get their employees healthy. You'll see the number of sick days go down. You'll see all kinds of things. So really, isn't that something that should be looked at first, and that is prevention? Eating less sugar and being less obese.
Prevention is important, but whether it's wellness programs and preventing the disease or whether it's a disease management program for those that have it, Liz, the challenge is that these employers are insuring themselves. They're taking on the risk. And they don't know the health risk of their population to know where to manage the financial risk. Yet Cisco or General Motors, to some extent, or even IBM, know so much about managing their core business, but in an area of healthcare costs, they have very little visibility in terms of how to manage those programs.
Cisco hired the doctor.
Are you suggesting we need a health czar, a healthcare czar?
We supposedly have a healthcare czar who's behind the curtains.
No, but I remember when President Kennedy actually had one of these fitness campaigns, and he directed it from the White House. He didn't have any czars, and he didn't direct money there, but should the president be stepping up on this?
It's funny you asked that. I have proposed that we, in fact, create a national campaign and a national award that the president endorses to try and get companies to compete, like the Malcolm Baldrige Award. And I've gotten buy-in from really both parties that have said this is a great idea. So in many companies. So yes, we are in fact going down that route.
Would you,
a bipartisan solution.
Dog-legging away from this, but would you be for the soda and sugar tax?
Managing our diets is important. Everything in moderation. I think that the McDonald's and the Burger Kings or the Pepsis of the world are clearly going to be against that. But we've got to moderate, for instance, what our children are being fed in schools.
Oh, yeah, definitely. Dr. Sreedhar Potarazu, great to see you in
Good
studio.
seeing you. Yes, thank you for
having me on.